Okay. Thank you. Today is Monday, October 18th, 2021, and it is 1 p.m. and we are here today for the Health and Human Services Committee meeting. I would like to welcome everyone and thank you for attending today. Are there any changes to the agenda?
No.
Okay. And let's see here. Is there anyone here for public comment? Katrina, did we have any requests, or is there anyone there at the chambers that would like to comment?
No, there's not, and we did not receive any.
Okay, thank you very much. As far as the chair's report is concerned, I know that the legislators that are on this call are probably pretty exhausted. We just finished our budget last week and have been in meetings pretty constantly over the past 2 months or so. And the one thing that I think we can be really proud of in this budget is that it does increase some of our proceeds to our Health and Human Services committees, or to our Health and Human Services organizations. And it is also good to see some of the other funding that we've allocated to some of our county departments. And that is really going to be most of my chair's report. I wanted to, I see Lisa Holmes is here. Lisa, do you have a county administrator's report today?
Thanks, Shauna. I'm somewhat in the same boat as you, having just gone through the budget process. So I don't really have much new to report to yours or this committee. Okay,
thank you. And today I am happy to be joined by Mr. Jordan Clements, who is here from Unbroken Promises Initiative, ID 10442. And Jordan is going to talk a little bit about this organization that he founded locally, what they do in our community, and give us a presentation and a PowerPoint. I believe all of us should have it in our packets, but he's also going to provide it up online. Hey, Jordan, thanks for joining us.
Hello, how you doing? I apologize, my voice. We started our youth enrichment program, and we actually traveled to Rochester. You know, this has been our third week with the youth, and we took them out to Rochester. So I was coaching them. You know, took them with basketball to a basketball tournament. So my voice is a little low, but I have my secretary and head of communications here with UPI here to assist me in the presentation. Monique, could you please introduce yourself? And Shauna, could you please give her ability to share the screen?
She should have the ability.
Yeah.
Good morning and welcome.
Hi, it's really great to be here. I am Monique Caraballo, and I am trying here to get this, there we go. And I am on the board of UPI as the board secretary, and I also am the head of communications for UPI. So pretty deeply rooted, and whenever we're ready to get started, I can start sharing my screen. And okay, great. Okay. Cool. So. Alrighty. Hopefully you're able to see this. Oh, that's the wrong button, sorry. Okay. All right. So I'm having a little bit of technical difficulty. Gonna need just a moment, I'm sorry.
No worries. You know what, Monique, do you mind if we go to the Office of the Aging and we could do the resolutions, and that'll give you about 5 or 10 minutes or so? Is that all right? Okay, why don't we do that?
Thank you.
You're welcome. Office for the Aging, Lisa Monroe, thank you for joining us. I see that you have 3 resolutions.
Yes.
Okay. The first one is grant acceptance and budget adjustment, lifespan of Greater Rochester, Office for the Aging ID 10434. Can I have a mover, please? Moved by Amanda and a seconder,
I can second it.
seconded by Mike Sigler. And can you explain the resolution to us?
Yeah, this is a grant acceptance for a mini grant that we received from Lifespan. It's in the New York State Caregiving Respite Coalition. Sorry about that. It's a grant for us to provide respite to caregivers of people with Parkinson's disease. Cheers. Sorry about my phone. I'm home. Yeah, so, and we're matching students from Ithaca College up with care receivers in the community to provide respite for them. They'll be trained specifically in respite services, and they'll be trained in Parkinson's disease. So we'll match them up. It's an 8-month grant and hopefully provide some respite to the caregivers.
That's really great. Are there any questions? Amanda?
I just want to say that I like the Office for the Aging because they're always telling us that they're accepting money from somewhere. So it's great.
Anytime. Any other questions? Okay, I see none. Why don't we vote on this? It's a roll call vote. Amanda Champion,
Yes.
Leslie Shield,
Yes.
Mike Sigler,
Yes.
and Henry Granison.
Yes.
And I am a yes, that's unanimous. Thank you. We have another resolution, County Office for the Aging budget transfer in order to move additional funding into its caregiver respite program, ID 10436. If I can have a mover, please. Moved by Amanda, seconded by Leslie. And Lisa, do you mind going over this resolution?
Shauna.
Sure.
Shauna, on the last one, you called Henry, and he's not a committee member. It should have been Leslie.
I am a
Oh, I
committee
think,
member.
no, Henry's vice chair.
I'm vice
Henry's
chair.
vice- Okay, you didn't call Leslie. Sorry about that, Henry.
Oh, sorry about that. Leslie, would you like to vote on the last resolution?
Yes, you did actually call me and I did say yes.
Okay,
Yes,
Okay,
yes,
sorry,
you
I
did.
missed it.
okay,
Maybe I was on mute. Whoops, sorry.
okay. I
Nope,
think
I
we're
heard you.
legit. Okay, so, sorry, Lisa, do you mind telling us a little bit about this resolution?
Sure. This is just a budget transfer into, obviously, we need respite services, but this particular budget transfer is into our program so it's specifically for caregivers of people of loved ones or care receivers who need in-home care. So we are moving some of the funding that we received through the CARES Act funding that allowed us to free up some county funds that we're moving into that line to make sure that we don't create a waiting list for those folks.
That's great. Any questions for Lisa? I see no hands. And let's go ahead and do a roll call. Leslie Shield,
Yes.
Amanda
Yes.
Champion, Mike Sigler, Mike, would you like to vote for this?
Yes.
Okay, and then Henry Granison?
Yes.
Okay, and I am a yes, that's unanimous. Okay, thank you. We have one final resolution for Office for Aging, budget adjustment. Tompkins County Office for the Aging, 2021 through 2022, unmet needs funding, ID 10407. And if I can have a mover, please. Moved by Leslie, seconded by Amanda. And can you tell us a little bit about this resolution?
So apparently all these resolutions are about home care today, which is great. I keep on the same theme, so it's easy to keep track of. So this is some funding that we received, additional funding through our unmet needs program, and through the major disaster declaration, we were able to move that funding into other areas that we might need. So we're putting it in our ISEP program, which is expanded in-home services for the elderly, and we can use that to ensure we don't create a larger waiting list there too. So it's just moving the money from one funding stream to another.
Okay, any questions for Lisa? I see no hands. Let's do a roll call. Leslie Schill,
Yes.
Amanda Champion,
Yes.
Henry Grandison, Henry, would you like to vote on the resolution?
Yes.
Okay, and Mike Sigler.
Yes.
Okay, and I'm a yes, that's unanimous. Thank you, Lisa.
Thank you.
And why don't we hop back to Monique and see if she is ready to present? If not, we do have some other business. We can move ahead.
I'm ready.
Okay.
Jordan will be sharing his screen, and I will happily help out there.
Okay, sounds great. Thank you.
One second. All right, we're in.
I am not seeing your screen if you're sharing it.
Yeah, it's just loading up right now. Okay, there we go. Are you guys able to see it, or did I not share it yet?
Not yet.
Okay.
Oh, it's coming up. Okay, there it is.
There we go.
Perfect. So thank you for seeing us and meeting with us today. We are Unbroken Promise Initiative. You can go ahead and skip to the next slide, Jordan. We're still working out how to do this.
That's all right. It gives us a little bit of a break.
I'm sure that's a little helpful, sure. Unbroken Promise Initiative is a grassroots social justice and neighborhood revitalization nonprofit dedicated to uplifting Ithaca's West End community, which you can see here. UPI was founded by Jordan Clemens, who is in the meeting with us. He emerged as a Black community leader in response to the murder of George Floyd. Upon hearing the outcry of his son to take action and knowing his hometown had to be pushed towards change to address systemic racial issues and oppression, Jordan organized and led rallies of 2,000 people single-handedly, compassionately challenging local residents to band together and allocate resources to the underserved communities of Ithaca's West Hill. Out of that movement, Unbroken Promise Initiative was founded. The vision for Unbroken Promise Initiative is to foster growth and development of Ithaca's underserved community, particularly in the West Hill for now, an area that houses the city's highest population of families living below the poverty threshold. And as leaders in this work, our future plan is to create a model which will provide every vulnerable community around the country with the same ability to move upward and onward safely. In the last year, UPI has actually only been around for just a little over a year. We have experienced astronomical growth. We've been able to take care a lot of our first steps in making UPI an organization and in building our community. And so we have a video that we would like to share with you that really showcases some of our first year as an organization.
Thank you, Mom. Hope you all enjoy. A year ago, we began a journey from the perimeter to the center. 2020 saw the resurgence of the Black lives across the nation. We, the people of Ithaca, joined in that national cry for justice. In August 2020, instead of relying on the powers that be to react and respond, we brought the spirit and intensity of the street protest to the direct service of our own community. Over generations, gentrification has pushed Black people out from the physical and economic centers of Ithaca. The West End has been underserved and over-policed, but in defiance of programs meant to break us, we will not submit. Sees community ownership, self-determination, and direct organized action as sources of justice and dignity for the West End people. In just a year, UPI is legally incorporated as a 501c3 nonprofit organization and established a board of directors as well as committees for our child care, mental health and wellness, community kitchen, community garden. We established weekly West Village community meetings, obtained fiscal sponsorship, and raised 30,000 plus from individual donors. We organized and collaborated with a strong base of pro bono lawyers, architects, engineers, marketing professionals, designers, fundraisers, grant writers, researchers, nonprofits, and businesses in the pursuit of our comprehensive and inclusive mission. This work has inspired other cities to approach us about adopting UPI's model. Looking forward, UPI's goal is to continue to build our capacity and community support, building partnerships with organizations, local businesses, and nonprofits, and unionizing underserved community residents. We hope to continue raising capital to hire our first employees and plan for upcoming operating goals. We will carry out UPI's planning phase for the West Village Community Center project, purchasing a plot of land to develop communities, submitting the budget proposal to the city of Ithaca in November. We must unionize, organize, and mobilize within our community and our community abroad. In order to do that, we must continue advocating for adding UPI to the city of Ithaca's 2022 budget. To make your voices heard, please submit comments. We will continue to hold on to our foundation of bringing the West End to the center of Ithaca to create a center that is inclusive in its prosperity. We have begun to restore all that we've lost. We would also like to give a special thanks to the city of Ithaca and the many community foundations and members near and far who have contributed to our journey thus far. But there's more to do. We must continue to heal our present and past generational traumas in order for this work to come to fruition. That's why it's very important for not only the city of Ithaca to be involved, but also the communities abroad to get behind the Black and brown disenfranchised and marginalized communities. To get involved in the fight, please go to www.unbroken.us. Thank you. Until we see you again, remain unbroken.
So if that was a little hard to hear for everybody else, we do have a link to the video inside of the slideshow, and I can also pop it in the chat if that's necessary.
Thank you, Mo. So I'll take it from here. A year ago. So what we did after we took it to the street, like the video said, we took it back to the community, and what we essentially did was, I thought about all of the things that we as a community had when we once resided in the flats, and how accessible they were, and how that has changed as the landscape of our community has changed, and people were, are residing now in the West End. And so we're talking about building a localized economy which fosters growth and development and helps people become self-sufficient and build sustainable lives for them and their families going forward. So if you look at the proposal, which is a comprehensive plan, pretty much outlining in detail our mission. So we call this the case for economic stability for disenfranchised and marginalized communities. The mission statement proposal summary is the vision for Unbroken Promise Initiative is to foster growth and development if it does underserved community members, particularly in the West Hill. The goal of the Unbroken Promise Initiative is to build a healthy, sustainable future for families on the West Hill, an area that houses the city's highest concentration of families living below the poverty threshold, which I believe Monique gave us that information in the beginning. The executive summary outlines in detail how we intend to build and empower the disenfranchised citizens on the West End / West Hill. We've already begun to do this work with reallocating resources, galvanizing and empowering and uplifting the community by doing community building stuff. Last summer of 2021, while the COVID was going on, as we all know, people all over the country, particularly focusing on our community, everyone was affected. But you really see disproportionately how people on the West End really were in a despair. It was really, they were really in a crisis state. And so what we did was we went right into the community and kind of used, because I believe in our community, we have a really good number of nonprofits who do great work around the community. And so what I did was I met with many of them who, dealt with food, who dealt with childcare services, who dealt with youth services, who dealt with community services. And I had them come in and do community outreach and community building within the West Village community, which, if you Google, you can see a lot of the things that we did with online. That in itself was very empowering. We were able to provide support, education, and like I said, the community building aspect to it, which we believe is key to helping people gain hope again. So what are we talking about in particularly outside of community services? We're talking about, also business enterprising, entrepreneurship and workforce development. That's key. Oftentimes on the West Hill, what you have is you have a lot of people who work in every other aspect of Ithaca as far as the size of the communities. And because they don't have their own access as far as their own vehicle, they spend resources that they don't have on transportation. Oftentimes because people don't even like to go over to the West End, they like to cater to the East Hill more rather. When we call to get a cab or when we call to have our needs met, we're usually on the back burner. So, for example, what's going on currently is we have people who will be calling for cabs, transportation to get to childcare, to get to work at the hospital, to get to work at Cornell, get to work even downtown, and the cabs won't even show up. They'll tell them 20, 30 minutes, but obviously somebody else might have called, might have had a better opportunity for the driver to, get a better, wage. And, they just choose not to even go over to West Hill, nor do they call the person. So then what you get is you get that person, particularly on the West Hill, who then has to deal with things, with their employment. So if we go down, you can see the planning team. We've been able to garner a lot of support. For me personally, I like to surround myself with people who are smarter than me. And so, what I did was we went and met with people who were experts and who could be brought into the table and into this initiative to help us with each and every aspect of improving the quality of life for people on the West End / West Hill. And, we believe that when doing that, it'll improve the quality of life for all people across our community. And so what does that look like? We have the legal counsel. We have people like Gary Ferguson, Lincoln Morris, Noah, and Andy. They're with my team as far as the development process goes and building an infrastructure to house the programming services and housing. We have our legal counsel, Carrie Polak. She's brilliant. She really focuses on the nonprofit side of our initiative. And then we have Adam Klossner, who's an attorney who specializes in real estate development. We have a board, as you've seen. We wanted this board initially to represent, our community as a whole. So we have, Black and brown women. We have, Caucasian men and women. We have, LGBTQ representatives. We have, youth, as young as myself, 34 years old, all the way up to, 60 years old on the board. So we have that where, we want a wide range of representation. The bigger vision is for the board to be made up of people who directly come from the communities, the most vulnerable population. So right now we have people, we've been training them in preparing them to be a part of the board. So people who don't come from and do not relate directly to the people that we're serving, they are holding space and training the people who are in the community to be able to have more stake and power over what we do at UPI. You see the collaboration advisory committees and team, Leslie McBean Claiborne, who's at, GAC, John Gutrich, owner of Press Bay Alley, Sue Dale Hall, at the Child Development Council, who was very who's very supportive of our child care initiative and loves what we're talking about there. Jude Rose, Jason Seidel with Cote d'Ivoire, who's coming in on our new farm to table initiative and our community kitchen aspect of our project. The list goes on and on. Jeff Furman, Diane Cohen, Leslie Danks Burke. The list goes on and on. So as far as projects, we're looking at implementing the child care, housing, community center, community garden, marketplace, health and wellness center, library, centralized on the west end / West Hill, right over there at the Army Reserve Depot. So we've been partnering with the city, Tom Knight, along with Gary and Joanne Cornish on using our initiative to be submitted to the federal government to get them to liquidate that property to the municipality, which is the city. And then we do a partnership with the city to implement these things on the Army Depot and on the West End. So as you can see, these are all the key collaborators. The list goes on and on. We wanted this project to build economic stability, obviously for the marginalized community on the West Hill. We want to create a place of hope and prosperity to begin the healing process of families who have been traumatized. We want to provide a safe space for Ithaca residents on the West Hill who are recovering from traumatic events. The West Hill Community Hub will serve as a space for residents to meet, work, place, and collaborate. The background description behind this project is since 1998, residents have been complaining about being stuck in the corner of the city, away from shopping and or services. While there has been some improvement, the community has continued to be under-resourced compared to the rest of Ithaca. The West Hill community still faces immense barriers to this day. Our second project we're looking at is on Cherry Street. We're looking for this project in the shorter term, the short future, to start the process of putting the youth enrichment resource center there or childcare there along with housing. Why are we looking at a smaller project compared to the Army Depot if that's our focus? Because the Army Depot is going to be a process between us and the city and then potentially the county. So we looked at a smaller property, which I'll share with you, on Cherry Street, which they just built the art house. So this is on sale for about $900,000, and we actually took a look at it, and it's really at the dead end on Cherry Street. So it's down the street from the art house, and we believe that this could be a great place for childcare, a UPI enrichment resource center, as well as we could add some housing on top. As far as excuse me, I thought I had my slide. Okay, continue. Okay, so that's where we are as far as the projects that we're looking at developing and where we want to put these things at. To support this, we did a research project collaboration with Cornell. You could actually find this information on our website at unbroken.us, and it really highlights and uplifts and amplifies the voices that we are looking to serve, and they are actually a part of this project. As you've seen in the proposal, they're actually at the forefront as far as collaboration. So moving forward, we want this to be the vision for the rest of the country. We understand that this is a big task. It's a long walk to freedom, but we believe that as a community, it's our job to embrace every step. As far as people we have coming in on this, we have the Park Foundation, we have Community Foundation, we have New York State's Empire State Development in on this. We have the Housing, Community, and Renewal people in on this who are backing this. They said that they would support this through federal and state grants to support this vision, because they believe that this is something that they would like to use and broaden this mission to build these infrastructures and these community services and housing across the state of New York. And so they see the vision, they understand the vision, and they are really excited. In the shorter term, we've been working with the city on the DRI grant, which we received from the state, and also we received the Legacy Cities grant. The DRI is for 10 million, which our initiative was a key component with Gary Ferguson in that. And then we have the Legacy Cities grant, which is 25 million. And then to address transportation, we're working with Scott Vanderpool and Matt Yarrow at TCAT. And we work on the electric mobility grant with Jennifer Dawson, TCAT, and Gary Ferguson. So UPI has really been operating, when you talk about funding, really at the state level for quite some time now, and within government, as well as making sure that we keep people on the ground, keeping people involved in the community. So as you see, one person can't do it all. I know it's, I'm from here, 6th generation. I went through the fire to see how the fire burned. I was willing to walk a path that most was willing to walk. And so as a result, I'm able to provide different perspectives unique to what we've had. But I can't do this alone. It's going to take a collaborative effort. And as a resident stated, as one person, it's hard to have your voice be heard. So you need the community behind you. It's frustrating, and it's why people don't speak for change. So thank you. That's the end of our presentation. Now we're going to open it up for questions. Thank you for your time.
Great, thank you so much. This is very interesting, and you could tell that you've put a lot of time and work into it. So thank you for coming to our committee and talking about your passion. Amanda Champion.
Yeah, thank you. This was really inspiring. And yeah, thanks, Shauna, for bringing them to our committee. I live on West Hill in the town of Ithaca, just above West Village. And so one question, you talked about a lot of the grants that you're getting, which is obviously awesome and much needed. Are you getting funding from the city of Ithaca much?
Yeah, I mean, we're actually in talks with the city where we were put into the mayor's budget. So we are going to be getting some funding from the city, and it's going to be a good amount of money. We went to the city last year. We didn't actually get into the budget. So then, because of the support of the city with the crowdfunding, we just took that money and really utilized it to the best of our ability to begin the community building process. And so that's where you see a bunch of our community members directly from and tied to West Village, to Chestnut, which is now Cayuga Gardens, to Cedar Creek, to Overlook, all the low income municipalities. We use that crowdsource funding at this point. That's what we've been utilizing. And then we also got commitments from Park and Community Foundation. So we were able to get 50,000 from there also this year, after refusing to take money from them in 2020. which they thought was really odd, because my thing was, what we're here to do is much bigger than money. Obviously, money, you need money to fuel the project, but essentially it's really about the people and the community coming together, and you got to show up and really have conversations. So we spent that time, that first year, 2020, really focusing on that. And then when we came back to the table, like we are here now, we had a bunch of our work to speak for what our impact is, off of 30,000, and what it could potentially be with the backing from the state, county and city and so on and so forth.
Yeah, that's great. And then, so my follow-up question is, what can we do as, this committee or the legislature, but also, as a concerned citizen, what can I do as just an individual to help?
That's a loaded question. I mean, there's a lot you can see, it's a big task. What we're looking for specifically is really partnership with the county. I mean, me, Sudell Hall, Jude Rose, we've spoken, they're part of the county, as far as the childcare stuff. We're going to be looking at, the state has said that when they start putting out childcare grants, they're going to be sending them directly to UPI, because they love the needs that we address in that childcare aspect of our initiative. And Jude Rose and the Child Development Council was looking to partner with us on our plan for childcare. So they were very excited, and we're looking to really collaborate with the county. From a transportation standpoint, that's also the county, right? So TCAT, we're already collaborating with them, working on grants, helping to bring more money to build, a stronger infrastructure to address the needs and run more efficiently and improve the quality of life for all people here. And then as far as, you as an individual, you could reach out to UPI. We don't discriminate. This is not a black and white thing. This is about a community. This is about community building. This is about coming together as a collective to address, needs that have been long overdue, so the mayor said. So, people believe in the mission, and we are just happy and gracious for everyone's commitment to this mission and initiative.
Thank you.
Thank you, Amanda. Leslie Shield.
Thank you. Thank you, Jordan. Really appreciate the presentation. I'm going to go to the website and dig into some of the links too. Try to get up to speed. So this is a great initial conversation, which is what I imagine this to be. I have a few questions and a suggestion, and I'm sure I'll have more, and I'll follow up offline after that. A couple of questions. You've presented a really broad approach, and I like that. You've got a social approach and a people-focused approach. You also have some ideas about infrastructure development and housing and childcare. I guess I was wondering a couple questions. I saw some pro bono partners that were on the list. Wondering if you have some developer partners that you're hoping to work with potentially, if you actually move forward on something as large as housing development or childcare facility development.
So I'm sorry, you said as far as the pro bono, what was your question as far as them?
You suggested a gamut of potential initiatives moving forward, including some that talked about real estate development into actual facilities, whether they're housing or childcare. I saw you went through the slides with some partners in the community that do kind of architecture design. I was wondering if you have any developer partners as part of that.
Absolutely. So we have John Guttridge and Lincoln Morris. So John was in the beginning, and then Lincoln Morris is, he's a developer that focuses on the West End. So actually we're in an office space that is his building. So as far as the housing and the development aspect, I've actually been on development crash course the last year with them. So they've actually mentored me this past year, and I actually have, they formed my own development company. So Noah and Andy are actually part of that team. We're going to be partnering on, building these infrastructures.
And then that's great. Thank you. I appreciate that. And then looked like there was a suggestion in a couple of areas for potential land purchase. Do you have a general approach planned for that?
Well, we have where we're at right now, if you want me to share the proposal again? But if
You know what, I'm happy to go in deeper on my
Yeah,
own,
know.
but just
So-
wanted to see what you
So
guys
just
are
in
thinking.
particular, when you look at what we were looking at, the phases, so we have to break it down into phases. So where we are right now, in particular, is the planning phase.
Yeah.
So what does the planning phase mean? What are our deliverables for 2023? I mean, excuse me, for 2022. We are going to be looking to take that proposal and build it up into a federal and state level proposal on every area of our initiatives in which we're covering. So, for example, you take Jude Rose, who specializes in, childcare planning and development. We actually are going to take our already comprehensive plan for childcare, and we're going to be looking to build that proposal up, for federal and state funding, and so on and so forth. And when you look at the community center / community services, same thing for that. We have, people in the community who have been in with GAC, Travis Brooks, et cetera. People have been in that field for a really long time. So for every initiative we have people who have the expertise who are going to be focusing on that. And so the committees are going to now take our solutions to address the needs, and now we're going to be providing by 2023 a more extensive proposal. So it's probably going to be about like a 500-page document, I imagine, by the time, so that's what we're going to be doing for 2022. And then we're going to also be planning, as far as the development, the planning, the architectural design, land surveying, land acquisition, testing the site, testing the soils and all that. That process is expensive. So, to answer your question, it's broken up into phases. So that's 2022, that's the planning. 2023, we will be providing a cost breakdown for every infrastructure that we're looking to build. And that's where you'll see the building and site costs. That's the construction phase. So we've broken the proposal down in 2 phases. Right now we're in the planning.
Thank you. One last just suggestion. You listed a lot of great facilities that are on West Hill, West End area that you're hoping to tie in together, including some local providers, organizations, and some actual physical spaces. One suggestion would be to tie in the local public school that's on West Hill too somehow. So how to integrate LACS into the kind of forward progress movement, thinking about that as hopefully a community center as well.
Yeah, that's a good thing. I've actually been in contact with Deborah Pack. So, I was brought in last year during 2020 when, our youth were struggling on the West Hill to actually provide counseling. So every Thursday for a period, I would meet with the young minority young men, and this was a project with me and Deborah that we did. So in the shorter term, how it goes with the Ithaca City School District, it's bureaucracy. So, we are looking and we've gotten the insurances and all that to be able to occupy the gymnasium to address access to a gym, but we haven't heard anything back. I talked to Deb, she's waiting for the facility uses to give the okay, but I've heard from all over the community that when you're trying to get usage of ICSD's facilities, it's almost like impossible. So now what we've been able to do, what we've had to do, because as people we have to do and use the resources that we have afforded to us, we actually have someone who owns a gymnasium space in Freeville. So what we've been able to do is we've been shuttling kids from the West Hill over to Freeville to forego our to continue our youth enrichment program because we didn't get any response back from LACS. And so I reached out to McGuire and I asked for a 15-passenger van. And so McGuire just called me a couple of days ago and said, one just came in and McGuire's looking to donate or help, contribute that 15-passenger van to address the needs to enhance the access for for transportation for this youth enrichment program that we're holding. So, you know, if it's been tough, but like I tell the people, it's not, you know, life is 10% about what happens to you, 90% how you respond to it. So, yeah.
Great. Thank you, Jordan and Leslie. Martha?
Hey, Jordan, good to see you. You know, we've had a couple of conversations already. I'm glad to hear you talking about a space on Cherry Street. I mean, if you talk about the ICSD bureaucracy or local government, just wait to get into the Army for the Army Depot property. I think that would be a very, very long-term plan. So the Cherry Street space, is that vacant right now and it's on the market?
Absolutely.
Okay, and then is there a, I didn't see on your slides what the cost is. Is that something, you know, you can share?
Oh yeah, I had,
On the slides.
I'll reshare it, so.
It was $8.99, Jordan.
Excuse me?
It was 900,000 or 899.
Yeah, yep. So I'll,
Okay, yeah, we don't need to see the slide. I know the buildings down there a little bit. Okay. All right, so then you're working, I mean, owning a property is one thing, you know, being able to heat it and maintain it, et cetera, is another thing. So, but this would be something that if you could put the money together, you'd have control way sooner than the Army Depot. So, I guess, and you and I talked about the county's process for recovery fund. Allocate, you know, we have a very, very early stages of a grant program that that staff is working to develop. That would be up to about $6.5 million total. So, you know, I know you'll just keep an eye on that process as it goes forward. So, just saying, you know, I support the idea of Cherry Street, especially with Art House moving in there, opening up soon. I think that's seems like a great opportunity. So good luck.
thank you, Martha. Thank you for the advice. You see.
All right, thanks.
Yep.
Any other questions from committee members? Okay, I see no other hands. Thank you so much, Monique and Jordan, for visiting with us today. And if there are any other questions, people can look on their website or reach out to Jordan and Monique specifically. Thank you both. We appreciate it. Good luck
Thank
to you.
You all have a great day.
Thank you.
Too. Okay, back to our committee work. We do have a resolution for Veteran Services. Resolution authorization to accept awards from various sources for the provision of services to veterans, military service members, and their families to the Department of Veteran Services. ID 10441. Can I have a mover? Moved by Leslie. And a seconder, please. Seconded by Amanda. And Mr. J.R. Claiborne is here. J.R., can you tell us a little bit about this resolution?
Yes. Hello, everybody. I get to be kind of in the same place as Lisa and Kofa, with saying that this is money. I just need you to accept it for me. This is, as you see in the resolution, this is money that comes from the New York State through the Division for Veteran Services, done through the Aid to Localities funds. And it's counties are awarded up to $10,000 yearly for the provision of veteran services to assist with it. In 19, because of when I was established, the office was established and I started this application, I missed the application window. So in 2020, when I got the letter, I went ahead and put in for both years and fortunately was awarded for both. And as you see, the monies came in, not quite a trickle, but they didn't come all in all at once. So it's spread out over the last 2 years. And so that's what that money is for. And also there is the couple of donations that came in through the Philopticus Greek Church, which I'm really appreciative of theirs. That came in unsolicited. Was actually, when I got it, I'm like, wow, this is nice, but what do I do with it? You know, how do I accept this? So that was actually my first learning in how the this part of the budget process works, because it's one thing to work within your budget. It's another to say, how do I accept this money? So that's what this is for. I think that's the longer story short. Going forward, there will not be a windfall of $20,000 yearly. So don't, as happy as I would like to be about that, that won't happen.
Great, thank you. Any other questions for JR? Okay, I see none. Let's go ahead and vote. Roll call vote. Amanda Champion,
Yes.
Leslie Shield,
Yes.
Henry Grandison,
Yes.
down your drink, Henry. It's time to vote. Mike Sigler.
Yes.
Okay, and I am a yes. That's unanimous. Thank you. Thank you very much, JR.
Thank you. All
It
right.
is time for departmental updates. Actually, JR, would you like to give us a short update for Veteran Services?
Sure. My big news is I've been working with a small team of folks in preparation for Veterans Day, and I and we will be approaching you with the full legislature next month with our intention of asking for an observance of Veterans Week. We found that there are quite a few activities that are happening around this region, not some outside of Tompkins County, but mostly inside. And they're within that week. So we figured, why not try and just bracket it that way and help our community celebrate our veterans for a full week.
That's great. It's exciting. Any
Yes, it is.
questions for JR or comments? I see none. Thank you very much, JR.
Thank you. Take care, everybody.
You too. Next up is Frank Krupa. Hi, Frank. Oh, Frank might be, oh, there we go.
I'm here, sorry. It's clicking
Hello.
about. Hey, how are y'all doing? I don't have much of an update. We'll obviously be giving a COVID update tomorrow night to the full legislature. Otherwise, we're continuing to work away on COVID and mental health. Lots of activities around engaging our clients in this new kind of hybrid environment of both in person and through telemedicine. So we continue to both retrofit the building with technology and look at our processes and procedures to make that work. We've also been offering some training opportunities to get some insight on the on how to more effectively provide telemedicine. We're also going to have another, so we just had a day where we weren't seeing clients. It was dedicated to staff being able to get some training. We'll be doing that again in November as well. And I think you guys know we have a budget item to do some pretty significant training in 2022 for them. It's a new environment, and just because we can do it doesn't mean we know how to do it the most effective way. So we're trying to get our staff the skills that they need to be successful for our clients.
Any questions for Frank? I actually have one quick one. I know that we received a large grant in order to be able to test kids in schools, and was wondering if that had started yet.
Yeah, so it has. We started with the symptomatic children doing PCR testing. BOCES is leading that, and the districts have access to the PCR testing through CMC for symptomatic children. We are still waiting for our the Buy Next Now cards that we ordered, the rapid tests. We ordered 17,000 of them in order to carry the school districts through for those that wanted to do the screening testing on site as well. We're hoping those arrive on Wednesday. And we are awaiting final budget approval from the state so that BOCES can begin hiring staff to help facilitate that testing as well. But in the interim, they have been using the PCR testing for districts that need it for some types of screening testing, perhaps with athletes or musicians or other very specific activities. So it's coming slower than we would have hoped, but we're getting closer.
Great. And I just wanted to touch base on contact tracing and see what the lag time is and how that's going.
Yeah, so it kind of depends. We're staffed pretty well now. We've got a lot of per diem nurses that are able to help us get through the cases almost the same day every time. Certainly, if cases come in later in the day, they may get rolled over to the next day. And then we're using the virtual contact tracers at the state, which I have been doing a pretty good job of doing them same day, next day. So generally speaking, I think it's going okay. Sometimes we get delays, particularly in pre-K through 12 settings while we're waiting for lists from the school districts, because they have to go through the guidance and, determine who should be on the list and who shouldn't. But generally speaking, I think we're doing fairly well. And we are still running into some challenges when our cases cross county borders and some of the delays that are associated with that. But otherwise, I think things are going as well as we had expected.
Great, thank you. Henry and then Martha.
Yes, Frank. I was wondering how the merge between public health and mental health is going.
Sure. Yeah, there's still activities going on. We have one of our cross-functional teams that is continuing to work through our strategic planning, one of our strategic planning goals. They've been talking to some consultants about branding to try to understand, how you go through an identity change and do that successfully. So they're kind of in the research phase of that now. Both the Board of Health and the Community Services Boards are reviewing their bylaws in anticipation of some changes that will need to be made as part of that merger process. And our administration group, so the financial folks, have been hiring and kind of completing the reorganization around that. And I imagine probably the beginning of 2022, they're going to get into the chart of accounts and how to merge those together in preparation for a proposal going into the budget season for next year. So we're probably 6 months away from bringing probably two bigger pieces to you. Consideration on bylaws, name, and charter review changes, and the chart of accounts associated with budgeting. So we're definitely still working away on it, slower than we would have hoped, but things hopefully will shift with COVID and we'll be able to get more focused on that.
Thank you.
Martha.
Yeah, hi, Frank. My question is about the fellows program, the state grant for the 7 fellows plus the coordinator. I wondered if you have any more information about what you can do with those folks and what you wanted to do with those folks.
Yeah, so we're recruiting for the coordinator position right now, which is the one that isn't provided to us by the state. Essentially a supervisor, for lack of a better way of describing it, for the fellows. We have a list of names. Brenda Crosby and I have been reviewing them, so we'll likely be talking to the fellows that are interested in the next week or two about setting up interviews. So timing wise, we're probably a few weeks from actually having folks be on staff. As far as what they can and can't do, it's really up to us to decide. There aren't a lot of restrictions on what they can and can't do, other than when they apply, they do offer areas of interest, and when we're bringing somebody on board, obviously we will have had conversations about whether or not what we'd be proposing for them to do would be a match or not. I think each of the divisions in the department have been looking internally about different projects that they might be able to have the fellows support while they're here as well.
Okay. Are you saying, are the fellows you're recruiting from the coordinator, are the fellows themselves actually, is there a list that you're picking from, or are they already identified? I'm a little confused by what you just said.
Yeah, so the coordinator is a position we were required to create through the contract, but that's one that we're recruiting through our normal civil service practices. For the fellows themselves, they have to apply through a state web portal, and then the state does a matching of fellows that are interested in working in different counties with the counties, and they provide us those lists of potential fellows. And then we get to talk to them and decide if it is an actual match and make an offer for them to come work with us.
So do we have some discretion, like among a list, we can pick 6 out of 20 or something like that? Or is that the idea?
Yeah, and or we could not fill positions if there wasn't anyone that we thought was a match. But yes,
Okay.
we have the final say on whether they come work for us, but we're choosing from a list that the state provides versus our normal civil service list.
Got it. Okay, thanks very much. Appreciate that.
Any other questions for Frank? Okay, I see no other hands. Thank you, Frank, and we'll see you tomorrow.
Thanks, everyone.
Okay, let's see here. Kate Shanks Booth, welcome to HHS. Would you like to give us a brief update on youth services?
Yeah, hi, good morning. Yeah, just a couple of things. So we've got October is Bullying Prevention Month, and so on the 27th we have Bailey Hudson from the Pacer National Prevention Center out of New York City coming to do, it's virtual, coming to do a presentation and a training around bullying and how adults can help, what type of bullying looks like in the post-COVID world. So that's pretty exciting. And then in November, we have Dr. Sherry Madigan out of the University of Calgary, who recently published one of the first peer-published articles that is picked up by Forbes and some other national news sources around resiliency and around the mental fallout and sort of stresses that have been put on youth post-COVID. And so she's going to be coming and doing a presentation for us in November. So that's what's on our training docket. And then just to update you guys, we've launched our Tompkins County Youth Services Snapshot, which is the quarterly newsletter we work with Dominic to get together. And we're going to be launching our first actual article in the next couple of weeks for that. We did go ahead and use that to put out a press release for the Governor's Youth Council. We're asking for people to go ahead and fill out the application process for that with the deadline of November 14th. And so we'll continue to put that on social media and all of those other avenues, but I just wanted to update you on those things. So that's what I have.
Great. Thank you, Kate. Any questions for Kate? Okay, I see no one. Thank you for joining us. Ken Clark, welcome to HHS. Do you have an update for us?
I do. Good afternoon. On the 26th, or rather in late September, we sponsored a program called Sin Papeles, which means no papers in Spanish. And it highlighted the plight of migrant workers in our region, the majority of which are of Latinx descent. And it was focused on issues of substandard income, a lack of healthcare, and the fear under which undocumented immigrants live. We had a migrant worker himself, Crispin Hernandez, who spoke of his experience with the help of a translator, who was Rebecca Fuentes, who is a migrant worker advocate. She too was a panelist, and she was joined by Patricia Fernandez de Castro Martinez of the Latino Civic Association. And Richard Rivera from OAR was a co-moderator with me of the program. We didn't get the attendance weeks we would have liked, but as of today, 86 people have viewed the program on our YouTube channel, which you can see on YouTube. And we're planning some upcoming events with CNY Fair Housing. One will provide a moratorium update for particularly focused on tenants because of the way in which housing and prices are increasing. Landlords are becoming more selective about who they'll rent to. And this selectivity can lead to discriminatory practices. And so we are going to be featuring, or rather co-sponsoring that program. And then we will be also planning a interaction with landlords about and having a conversation with them about policies and practices that can avoid violations in terms of housing. And then a policy-focused update for activists and housing workers, which we're planning. We're looking at doing this sometime in November. We will get out dates to you once they are confirmed for these programs. We have resumed now with schools being open again, our human rights arts competition, which we canceled last year because of the pandemic. But we have begun the process in which students will begin making submissions at the K through 12 level and as of the first Monday in November, and we will be receiving submissions up until the first week in January, and we're planning to have an awards ceremony the first weekend in February. So we are in the process of restarting that competition and engaging students around human rights issues, and we've made some modifications in the process and in the ways in which students can present on human rights issues. So that's it for us.
Great, thank you, Reverend Ken. Any questions, Henry?
Yes, Reverend Clark, I know that a couple of years ago, the New York State passed a source of income law. Have you worked, and have you worked with CNY Fair Housing with it? Has there been any cases? Has there been any activity regarding source of income violations?
We have not seen any source of income complaints in our office specifically. What we have found out recently is that law in New York has, and we'll be in contact with them about what they've seen. But while we have had a number of housing concerns in the forms of complaints come to us, we've not seen any specifically addressing source of income violations.
Okay. Are complaints back up to where they were pre-COVID?
Not quite. Not quite, although they are picking up, and now that we have reopened the office and are receiving, walk-ins, I mean, we're not quite where we were prior to the onset of the pandemic in March, nearly 2 years ago. But it's starting. We're starting to see a little bit more inquiry by phone, by email, by walk-ins.
Thank you.
Mm-hmm.
Any other questions for Reverend Ken? Okay, thank you very much.
Mm-hmm.
We have Kit Kephart and then Kathy Schlauner.
Hi, everybody. Geez, I'm just realizing I haven't had my camera on for a while, and I look really up close. So we've got a couple of things going on. One is that we are working hard right now on at social services on putting Family First in place. That was new legislation that started at the end of September and really affects our Children's Services Division. It affects our ability to pay for and place children in congregate care. And there's a number of pieces of that we are still in the process of putting in place. We're working kind of across the state and with OCFS to get that settled and up and running. We also are readying ourselves right now for the start of Code Blue. We've had really a remarkably mild fall so far, which has been great. But we're in the process of putting that in place. I'm really pleased that, and I'm keeping my fingers crossed as I say this, that with COVID numbers looking, better than they have, we're very hopeful that we're going to be able to utilize some congregate space for sheltering through Code Blue. So we're working with St. John's Community Services to put all of that in place. Last, I want to give people a real quick ERAP update. I know there's a tremendous amount of information out now on the OTDA website about this, so you can check that out. You can just type into Google OTDA ERAP, and you'll find a lot of information. The ERAP program obviously is the Emergency Rental Assistance Program. For anybody that's not aware, that's a statewide program that locally 211 is helping us administer that program and not administer, I should say, get people signed up and help advocate for people with that program. So the next phase of that program.
You're on mute.
Sorry about that. My cat just muted me. I'm home today, which is unusual for me, but I apologize. She reached up and hit my space bar. So the final phase of ERAP has been that OTDA has dedicated $250 million, 125 million of which will be dedicated to assisting the landlord component. So when renters, when tenants are not willing to participate in the ERAP program, or if they have left the rental unit, but there are still arrears for rent, this program will now cover that 80 to 100% AMI range for folks that are going to be, for landlords that are going to be looking to pick up help from the program. The first 45 days of this component of the program will actually cover smaller landlords, people with 20 units or less. It goes up to that 100, I'm sorry, I said 80 to 100. I believe it's the full category. So it's I think 30% of AMI all the way up to 120% of the AMI. You know, we're really trying to encourage and get the word out about this, because we are hearing kind of statewide that OTDA is anticipating that the money for the ERAP program will probably likely all be obligated at some point late fall. Doesn't mean it's all been paid out at that point, but it will likely be obligated. The money is flowing. The money is getting out there in the community. We don't have full figures, but we know that it's moving and that people are beginning to see money go out there. So so that's kind of another component of this program that I think is going to be a huge help to folks. So I think that's it for social services at this point.
Thank you, Kit. Leslie, and then Henry.
Thank you. Quick question, Kit. Do we know how many folks in the community and the county actually applied through your app?
So it's a statewide app, and I can probably pull that up. I should have actually looked at that. I apologize. I can probably pull that up pretty quickly for you. Okay. Oh, hang on just a minute. My computer does not want to load it.
Kit, if you want, you could just send it in an email. That's not a big deal.
Sure. Just so we know over time. I know that the money is starting to flow, but understanding, you know, what was the demonstrated need based on actual applications would be helpful.
Sure. So I can tell you, I just got it. I was just able to pull it up. So the arrears applications in the county so far are about 627 applications for our county. And that's for arrears for rent. The prospective, so there could be some crossover here. The prospective for rent in our county is at 531. And then again, there could be some crossover in terms of help with utilities. That's at about 155. So that gives you a sense of kind of how many applicants there have been out there in the most recent reports.
Thank you. I don't know if you all are planning in longer term and looking at geographically around where folks are, or how we attend to, you know, where people are getting the fastest response, basically with funding or anything like this. But we're certainly interested in any of those stats as they get updated.
Sure. And what I can do is provide the link. I believe that there is now, I'll have to double check, but I'm pretty sure that OTDA has now provided on their website information by zip code. So you can actually go and look, look at what's available, but I'll double check that and I can send you the link for that as well.
Thanks.
Sure.
Henry and then Martha.
Yes, Kit, thank you. Do you know, has the landlord funding been sent out yet? Has people applied for that yet?
I don't think so. They're just opening this landlord only kind of component of the program. So there is, up until now, the ERAP program has been providing supports to landlords, but it's required the tenant and the landlord to work together.
Right.
So when it comes to landlord only, the money probably isn't going out yet because they're just getting that component program, that component of the program going. But yes, in terms of other payments where tenants and landlords have cooperated, that money has been going out to people for a while.
For the high AMI money that they're giving out, I assume that's the same situation that basically people have applied but haven't heard yet.
So no, people are getting, so you're saying in terms of like, have people been getting checks for that?
Yeah,
So,
people who have, well, the high AMI that they just changed a couple of weeks ago.
yeah, I believe that has started to be dispersed. We, again, I would have to check to double check. But the data that we're getting is not always broken out, in various categories. So, but I am hearing that is being processed and going out. The other important thing to know is that as people have been applying from the very beginning of the program, OTDA has not actually denied either any or many of the applications. So I believe that they're in a process right now of looking at applications that might have come in a while ago that may qualify for some of these additional program components. And they're going to be working with those and trying to include those rather than having to have people reapply. So it could be that as new components of the program open, and people are eligible, checks will go out to those folks that weren't initially eligible with the first components of the program, if that makes sense.
Yeah, one last question. Do you have any update on the Raise the Age program? The congregate beds,
Oh, in terms of detention, in terms of having availability of detention beds.
Right.
I don't have much of an update. I am working with the consortium that kind of was put on hold at the beginning of the COVID crisis, but I don't have much of an update there. There have been some conversations with OCFS, but we're actually waiting for some responses right now about what funding might be available. So that's unfortunately the best I've got at this point. When I have more information, I'll definitely share it.
Okay, thank you.
Sure.
Martha?
Thanks, Shauna. Thank you, Kit. Great numbers on the applications. That's, I think a much bigger numbers than we had heard before. So props to Kathy and her staff. So I want to ask Kathy a question in a second, but my memory is that the original federal funding for this to New York was 2.3 billion. And I believe I saw must have been on the, not sure where I saw it, but that like 1.8 billion has already been either allocated or obligated. I think that was the number. So even though these are nice big numbers, I mean, that means that we only have 500 million left. When I say only, it's because, depending on how many of these 627 applications, for arrears might be in the obligated group already, it's still like a really big question as to whether people are actually going to get the money. So you're saying that OTDA has not actually rejected very many people yet. It's mostly kind of holding people and not answering yet and seeing if they fit into one or another category.
That's what I'm hearing. I don't know, Kathy, are you hearing anything different than that? I am hearing that they have not denied, but they're holding those applications and reassessing them.
No, I haven't heard anything different than that.
Yeah, we
Okay.
just had a meeting with OTDA last week, and that's what they were saying to people, is that they haven't denied people, and that they are kind of relooking at those applications. So I'm hoping that that's a positive. My fear would be that if they had rejected, or denied applications, then people would have to reapply, and they might lose a lot of people that way. So I think they're trying to avoid that. So that's, I'm hopeful.
Well, that's good. Even though it means people are still in limbo. I did hear, the way I remember the public, the national debate was that some states were not using, or were not trying to use the money. And I think it was as of September, states could ask for additional allocations from, like, any state that wasn't using their money could get reallocated. And I think I heard that Governor Hochul did formally ask for additional funding from the feds. Is that your memory too?
I haven't
That.
I haven't heard anything about that. That would be great, because I think New York State will continue to need the support, but I haven't heard anything. I mean, we get almost all of our information directly from OTDA, which is an agency of the state. So we only are hearing about the New York State system. So.
All right, I'm pretty sure I saw that in the news somewhere. I'll look for that and send it along. So Kathy, how's it going with your staff, and what's their experience? Do they feel like people are kind of getting through the system?
Yeah, and certainly easier than it was in the beginning. The state is trying to close some of those more difficult loops. We still have people applying, so that would be great if there was more money, because we know that with the moratorium, there's just going to be a group of people who just won't do anything until that point is right, upon them, and it's going to be too late for a lot of people. If there isn't any more funding. We are just starting to do, because you hear them putting out radio ads, letting people know that it's now 120%, which it's a lot of money. I mean, 120% of AMI is over $100,000 for a family of 4. So just because people, I think, that doesn't come, right away. They understand that they think of this as a program still think of this as people over 30% of AMI or 50%. So trying to encourage people to apply now and not wait. But I know the 2 people we have helping people are still pretty busy. Every time I walk by, they're on the phone. So.
Okay, well, thank you very much for the update. It is a great opportunity, sort of an unusually good opportunity. And it sounds like, people are really working to make the connection. So thank you both.
Okay, Kit, did you have any other updates for us?
Nope, I'm all set. Thank you so much.
Thank you. Kathy, would you like to add any updates?
Just said that you're up there. Just 2 more things. I always like to remind people that open enrollment is going to start November 16th. It's always scheduled to go through January 31st. So far, every year they've extended that, but that time tends to go fast for people, especially around the holidays. People mean to go into open enrollment and they kind of forget about it. So remind people that's going. And we're also working on a home health aid recognition week, which is November 7th through November 13th. Having still going to be a virtual this year event to recognize all the good work that our home health aides do. So that is pretty much it. We're still working on a lot of our housing programs and, hoping things get back to normal soon.
Don't we all?
Whatever normal is, whatever
right.
that is.
That's right. Thank you, Kathy. Any questions for Kathy? Okay.
Nope. In case you know anybody, tomorrow's the last day to put in an application for my position. So.
Okay. I've heard they didn't have any applicants and you're going to have to stay for another year or two.
I have heard that is not true, but I don't.
Okay, bummer. So let's see here. We have some minutes to approve. If I could have a mover for September 20th, 2021 minutes, moved by Leslie, seconded by Amanda. Any questions or comments about those minutes? I see none. Let's vote. Amanda Champion,
Yes.
Leslie Shill,
Yes.
Henry Grandison,
Yes.
and Mike Sigler.
Yes.
And I am a yes as well. Those are passed. And do we have any additional comments from committee members or liaison assignment reports? Martha?
Yes, ma'am. I'm liaison to Human Services Coalition and on the search committee for Kathy's position. And yeah, it's not, they've got, I think, at least 39 applicants. I think 21 have been screened and sort of approved to have met minimum qualifications. So there are, I think, at least 21 that the committee will be reviewing. Just thought I'd mention that. All right. Yep.
I was trying to create some fake news, so.
Well, I think we'd all, I'm sure Kathy wouldn't mind, if she were 10 years younger to keep going, but I'm in that boat too, Kathy. We're not 10 years younger.
Great.
All right, thanks.
Okay, everyone. This meeting is adjourned. Have a great day. Thank you.